welcome you to the live phone-in program organized by the All India Institute of Speech and Hearing, Mysuru, as a part of the World Hearing Day 2021. I am Anup. I'm working as a lecturer in the Department of Audiology, and I will be the moderator for today's event. Today, the theme of the phone-in program is how uh, hearing and hearing problems can affect school and scholastic performance in children, and what are the relations between the two. To discuss on this aspect, we have two resource persons, Dr. Jayashree Shanbhai. She is working as the head of Telecenter for Persons with Communication Disorders, and we have Dr. Chandni Jain. She is working as a reader in the Department of Audiology. We also have Mr. Rajkumar. He is working in the Special Education Department as a sign language interpreter. So we welcome any calls at any point of time. To start with, I would like to begin with a few basic questions about how is it relevant to different pathologies. So the resource people, what are the different problems that a child can experience in school, and how is it related to hearing?
Very good afternoon to everyone. So, all of you think when the child is not performing well in school, he doesn't want to do it, but that is not always the case. There can be a genuine reason behind it. Today, we are going to talk about the reason related to hearing. So, in hearing related issues, it can be either hearing loss, that is, his hearing sensitivity might be reduced, and because of that, he might not do well in the school. But that is identified quite easily, okay, because teachers might understand that the child is not hearing well. But other than that, there is something called as central auditory processing disorder, which is quite common. It is around 3 to 4% in school going children, which can also cause academic difficulties. Okay, so when we talk about central auditory processing disorder, the hearing would be normal in them, but they'll not be able to process what is told to them. Their understanding would be affected. Okay, and that is the reason they'll have various school related difficulties, right? Like they might not perform well when the other children are speaking, that is in noisy situation they might perform very poor. Okay, other than that, when teacher gives very long instructions, they might forget it. They'll be doing very poor in academics in terms of spelling, mathematics, their memory would be poor. So these are some of the difficulties which might be seen in school going children, which might not always be attributed to hearing loss, but can be attributed to this processing difficulties.
So, like how Dr. Chandni was just talking about the various hearing problems and auditory processing disorders that we were talking about. So, what happens is in some of these children, um, I'm sure Dr. Chandni also will agree. There have been reports in the literature that middle ear infections have been found to cause some amount of auditory processing problems in school children, especially. But what is important to note is some of these middle ear infections are actually treatable, and they have to be treated as early as possible so that they are not leading to some form of auditory processing disorders. Now, being a speech language pathologist, maybe I will just give a little more idea on what can happen in these school children because of auditory processing disorders. So some of these children tend to develop their speech language skills late. Okay, so we call them as a specific language impairment. And it's also possible that since these children have problem picking up speech because of an auditory processing problem, they can show up with comprehension difficulties, which means to say that whatever instructions is given in the classroom by the teachers, they might find it difficult to process that information, or they might take a longer time to process that information. So, this is something which is very alarming because I think most of the instructions that happen in school is more auditory based. So, if the children are not really comprehending the information, you know that they're not processing the information as well. So, this is where we see that there are a lot of children who come out as children with learning disability with auditory processing problems. Yeah.
We have our first caller. Hello? Hello?
Hello, sir.
Heli? Heli?
Hello, sir. Can you speak English, sir?
या हम बोल सकते हैं, बोलिए. Can you be a little louder, please?
Hello, sir. Can you hear me?
Yeah.
Yes, sir. My child is studying in 6th standard.
Okay.
He's back in his maths and English subjects.
Okay.
But I then talked to the teachers, class teacher, and then the teacher told me that he's not listening to the classes, and he started with the students in the classroom. And he's not writing the notes also. Then
Okay.
they asked me to check up in ear checkup, and then I have done that. Is there any other treatment that I can do, or any help, any rehabilitation that I can afford?
Okay.
I think she said that the child is performing poor in.
Fifth standard and mathematics, especially.
Maths and English.
Yeah.
Okay. So, as you said that the hearing testing is already done, we basically do a basic hearing testing wherein we first see whether the hearing is normal or not. Okay, and as I said, the hearing might be totally normal in these children. Okay, so if it is due to uh, central auditory processing disorder, we need to do a detailed checking wherein we'll be checking for what is the process or what is the difficulty the child is having, because maths is something which is commonly affected in children with central auditory processing disorder, which, as Dr. Jayashree also said, can like lead to learning disability. Okay, and you're saying that he doesn't like to write. That also could be because he's not processing it. Okay, if he's not able to process, it becomes very difficult for him to write. So like if the teacher is dictating, it might be difficult for him to note down. Okay, so if the teacher writes it and gives it in the board, he might find it easier. Okay, so if you can get him here and we can do a detailed assessment, we can these children will perform well if we work specifically on those deficits which the child is having. Okay.
So, ma'am, just give me some more information. Does your child have problem with other subjects or only maths and English? Um,
Only maths and English, ma'am.
Okay, only maths and English. See, generally what happens, a lot of these conditions, of course, what Dr. Chandni said, I totally agree with that, that if you want to clarify your doubts, I think it's always better to come to the professional and get the evaluations done. But just to give you a little more information, if these children tend to have a disability, it's usually not specific to a subject. It
subject.
might be little more in one subject or little less in another subject, but they will tend to have processing issues for all the subjects. Okay, so what I would suggest is please bring your child. Sometimes there are other factors. For example, if a child is not exposed to a particular language so well, or his environment does not have English, or he has had a change of medium of instruction, so in those cases there is a tendency that the child has problem in English. But still, no, we would suggest that you seek a professional's help and then rule out the problem.
Yes, sir.
Any other questions?
No, sir. Thank you, sir.
Thank you so much for calling.
And get the appointments, ma'am.
Yeah, sure.
Thank you, sir.
Thank you. Okay, doctors, you mentioned that children might have difficulties in different aspects of understanding. Can you tell me and the audience what are the different things that the children might face? What are the parents that they need to know? How do they identify it? Can you give more information on that?
Okay, maybe I'll start off with some basic information. See, there is some information that children, when they're processing, they can have problems either in bottom up processing or top down processing.
Okay, we'll take the call first. Hello? Hello? Hello?
Hello.
ಹೇಳಿ?
ಅದು question is how should the school accommodate a child with a hearing loss?
Okay. The question is how should the child be accommodated in a school and if the child has a hearing loss?
The hearing loss.
Okay. So normally, if child is identified early, okay, and if we rehabilitate the child with the hearing aid, right? So initially, for few years, child has to be given individual therapy, okay, and he might have to go for a special school depending upon whether what is the level of the child, okay, and if he is doing well enough as compared to his peer, he can be accommodated in a normal school with a special instructions to teachers, okay, as well as most of the school do have a special educator, so he can get special help from that special educator, okay. But parents can always instruct teachers that because child is having a hearing loss and his needs are special, he can be put in the front row, okay. Teacher should make sure that when she's talking, she is looking towards the child and she's talking, so that the information is not missed out, okay. And even most of the teachers have the ability that they talk and they write, right? They have the ability, they tend to do two things at a time. So we need to instruct them that they should be doing one thing, because for a child with hearing impaired, he might find it difficult to process two things at a time, okay. And you can always assign you can always request teacher that you assign a peer partner for the child, so that there's always one child who is there to help this child with hearing impairment, okay. And it's always better that the class strength is lesser, but practically that is not always possible.
Yeah, yeah, yeah. Okay.
Any other doubt you have?
No, no, that's it. Thank
Oh,
you.
thank you.
Thank you.
So we were talking about processing problems. So before we start, maybe I should just give some very basic thing that whenever we understand information, it goes right from our ear. Okay, so there is sensation, then you actually have perception, then you are assigning some kind of meaning to it, and then you also have components of cognition, which is nothing but your thinking skill and reasoning skill and so on. So only after all these things are functioning normally, that's when a child is able to understand the information. So as professionals, I think what we see is from that level. That is why Dr. Chandni was saying that there can be some children who actually don't have problem with hearing. That means their thresholds are normal, but still they have problem understanding the information. Now these are some of the red flags that we have to catch, because these are the children most of the time who are not understood by people around them, especially the school teachers or the parents. They think they're just lazy, they kind of hear everything but they are not doing the work and things like that. So now when we are talking about processing, first you have to rule out the sensation, make sure that everything is fine. The next thing is, like how she mentioned, there is a skill called as auditory discrimination. Maybe Dr. Chandni can talk more about it. There is also a skill wherein they have to understand information in spite of a background noise or distractions. Okay. There is also a skill wherein when a teacher asks a question, the child is supposed to listen to it properly, understand, and then answer the question.
We'll take the next call. Hello? Hello?
Hello.
Heli?
I'm Malvi calling from Tamil Nadu.
Sorry?
Tamil Nadu.
Hello.
Yeah?
Can you hear me?
Yeah.
I'm Malvi calling from Tamil Nadu.
Okay.
I am an online teacher and I have a student who's hearing impaired. So could you just help me? Can you just tell me a few things like how can I manage a student along with other students who can like hear me properly during class?
Okay. The question is, how do we handle a child with hearing problems while doing it online,
Yeah.
right?
Online class, yeah.
Yeah.
Like and there are other students who are like capable and they're perfect. So like along with them, like how do I manage a student like that?
Okay.
So maybe she's talking about an
Online.
integrated setup wherein online she's training the child
Yeah,
for
I
online.
think this problem has come up because of the pandemic which we are facing right now. So
Exactly.
we also do have started online listening therapy for children with hearing impairment. So what we normally do is we make them sit with one of the guardian, because when you're doing it online, there's already a difficulty in listening, right? Because the child, there might be internet issues and child might not hear you so well. Okay, with even with hearing it, he might not hear you so well. So it's always better that you all make sure that a guardian is there along with the child, and whatever information you are giving, try giving it with the visual cue. Okay, you can always have a PowerPoint, so that if the child misses out what you're saying, he can use that PowerPoint along with that. And it will always also be better that you beforehand you tell the guardian that next online class, what you're going to teach, so the parent can make the child prepare a bit, so it will be easier for you to teach when you are teaching it next time.
Okay, okay.
Okay, and as I said, for the normal school also, it's always better that you don't avoid your lip cues, so it's better that you give that also, because listening is affected over there.
Okay, okay.
Okay, I hope it answers your question.
Thank, yeah, yeah, you did. Thank you very much.
Yeah, thank you.
I think with this method, I'll be able to carry out the classes very well for my students.
Thank you.
Thank you very much.
Thank you so much. Okay, Dr. Joshi was talking about the different aspects of communication and comprehension.
Yes. So I was just saying that when you understand the information, it's not merely an understanding of information, but there are so many underlying steps that we have to go through, right from sensation till comprehending the information. So anywhere anything goes wrong, then you know that the information is not really processed.
We'll take the next call. Hello? Hello?
Hello, sir.
Yeah?
Yeah, I actually wanted to, I had a doubt regarding my son.
Okay, please go on.
Yeah, so actually, like, he's going to school now, so like he's like in second standard, but he hears things, but he's not able to understand the classes properly.
Okay.
Like, he sits through the whole class. Like now he has online classes, right? So he sits through the class, but he like, listens to everything. But I think he has a problem in understanding. So like, I try normal methods, like try teaching him more and all. But is it like related to like the reading ability or like that learning disability, or should I be concerned, or is that normal? I wanted to know.
Yeah.
So please give us little more information. In which class is he now? Second standard, you said.
Hello.
In which class is he now? Second standard?
Second standard, yeah.
Okay. See, what I'm saying is, we were just talking about it. There are chances that you have this child who's not comprehending the information, and that's why he might be having problems in classroom, and that is the reason he's not following out the instructions and so on. Okay, but we still have to evaluate him. Okay, that's more important, because sometimes it is possible. There are certain children who do not pay attention. Okay, there are certain children who can be lazy. They're very good in other things, but when it comes to certain subjects, they're just put off, so they don't attend to those subjects. And especially the younger children. Okay, younger children are still stabilizing with their behaviors. So especially when you see these preschool children, or first grade, second grade, and third grade children, they are kind of not yet synced into that proper education system. Okay, so they're still very playful, so you will see them not attending to classes so much. So I think it's always good that you get a professional opinion, okay, and find out whether the child really has a problem. And another thing that I want to know is, did the child develop his speech language skills normally? Did he start speaking by 1 year of age, saying a word by 1 year of
Yeah,
age?
yeah, yeah. Yes. Like
Yes.
1 year. Yeah.
Okay. So, otherwise, how is he in other activities?
He's good with sports and everything, but just the like things with studying part, yeah, he's just slow, like very slow.
Hmm. Is
So
this your, is
just wanted
this
to
your
know if
first child? Is this a first child, or he has a sibling?
no, no, he's the only child.
He's the only child. Okay, now you will have to get him evaluated. That is most important. At least we are glad that he has picked up speech language at an appropriate age. But still, we would like to see, since he's second standard, he should have mastered most of the basic language skills by now. So we need to check on that. For example, whether he's doing narrations, whether he can tell you what he did when he came back from school, okay, or whether he's able to retain some information in his memory and recall and tell it back to you. So these are some of the things that the professionals are going to check. Another very important thing is IQ. Okay, IQ evaluation has to be done. We need to find out whether, it seems like if he has picked up speech language skills appropriately, IQ can be of the same age, but still I would recommend that you bring him for an evaluation.
Okay.
So generally this involves a team of people, okay, like Dr. Chandni is here. She is basically from an audiology background. She's an audiology expert. So you will have to get the hearing evaluations and the auditory processing tests done. And I'm a speech language pathologist, so you'll have to check on how their speech language skills are. You'll also have to see a clinical psychologist who will look out for his cognitive skills. And if required, an occupational therapist and a special educator will also look out if he has any issues. Okay, so these are the professionals generally who are involved in these conditions. So I would recommend you to see your child. And another thing that I want to say is Aish has an option for tele-assessment. So you might be wondering now, should you bring the child all the way to Aish or you can get it done somewhere else? So you still have an option to do it outside, but I think getting all the professionals in one roof and getting a tele-assessment done through Aish is something that I would recommend. So you could always avail our services. So if you go to our website, that is www.aishmysore.in, that is www.aishmysore.in. So there on the right hand side, you can fix up an appointment and get these assessments done. Okay.
Okay. Yeah. Sure. I'll just look into it. Yeah. And the tele assessment is like, is there a timing you have to fix an appointment?
Yes, you have to go to our website and you'll get the details there.
Okay. Okay. Yeah. Sure. I'll look
Okay.
into that. Yeah. Thank you.
Thank you.
So maybe I will let Dr. Chandni to continue. Maybe you can give some more idea on the bottom-up processing that we would want to look out for in these children.
Okay, so as Dr. Jayashree said, we normally, when we understand something, we understand it through two ways, that is bottom up as well as top down. Okay, so when the information is new to us, okay, we try to use more of bottom up processing. We'll take the next
Come
call.
back to this. Hello? Hello?
ಹಲೋ ಸರ್ ನಮಸ್ಕಾರ ಸರ್
ಹೇಳಿ.
ಸರ್ ನಮ್ದು ಕ್ವಶನ್ ಬಂದು ಇವಾಗ ಮಕ್ಕಳಿಗೆ ಸ್ಕೂಲಲ್ಲಿ ಅಂದ್ರೆ ಅವ್ರಿಗೆ ಕಿವಿ ಕೇಳಿಸಲ್ಲ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್ ಇದೆ.
ಓಕೆ.
ಸೊ ಅದಕ್ಕೆ ಅವ್ರ ಕ್ಲಾಸಲ್ಲಿ ಈಗ ಟೀಚರ್ಸ್ ಹೇಳ್ಬೇಕಾದ್ರೆ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕಾಗಲ್ಲ. ಸೊ ಅದಕ್ಕೆ ಬೇರೆ ಏನಾದರೂ ಮಾಡ್ಬೋದು.
ನೀವು ನಿಮಗೆ ಹೇಗೆ ಗೊತ್ತಾಯ್ತು ಅವನಿಗೆ ಕೆಲಸ ಸರಿಯಾಗಿ ಕೇಳಲ್ಲ ಅಂತ?
ಅಂದ್ರೆ ಮೇಡಮ್ ಅವ್ರಿಗೆ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳಲ್ಲ ಅವರು. ಈಗ ಪಾಠ ಮಾಡ್ತಾ ಇರ್ಬೇಕಾದ್ರೆ ಕ್ವಶನ್ ಕೇಳಿದ್ರೆ ಆನ್ಸರ್ ಮಾಡಲ್ಲ. ಸೊ ಅದು ಅರ್ಥ ಆಗಿರಲ್ಲ ಅಂತ.
ಮತ್ತೆ ನೀವು ದೂರಿಂದ ಕರಿವಾಗ ಕೇಳ್ತಾನ?
ದೂರಿಂದ ಕರೆದ್ರೆ ಕೇಳಲ್ಲ, ಹತ್ತಿರದಿಂದ ಇದ್ರೆ ಕೇಳ್ತಾರೆ.
ಓಕೆ, ಎಷ್ಟನೇ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಈಗ?
6th ಸ್ಟ್ಯಾಂಡರ್ಡ್.
ಓಕೆ, ನಿಮ್ಮ ಮೈಸೂರಿಂದನಾ?
ಮೈಸೂರಿಂದ ಮೈಸೂರು.
ಓಕೆ, ಸೊ ನೀವು ಆ್ಯಕ್ಚುಲಿ ಇಲ್ಲಿ ಬಂದುಬಿಟ್ಟು ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕು ಅವನಿಗೆ ಎಷ್ಟು ಕೇಳೋಕ್ಕೆ ಎಷ್ಟು ಕಡಿಮೆ ಇದೆ ಅಂತ. ಅದ್ರ ಪ್ರಕಾರ ಅವನಿಗೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಬೇಕಾ ಇಲ್ವಾ ಅವ್ರು ಹಾಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳ್ಬೋದು. ಓಕೆ, ಬಿಕಾಸ್ ನಮಗೆ ಕೇಳಲ್ಲ ಅದು ಗೊತ್ತಾಯಿತು, ಬಟ್ ಎಷ್ಟು ಕೇಳ್ತಾ ಇಲ್ಲ ಅದು ಗೊತ್ತಾಗಬೇಕು. ಎಸ್. ಸೊ ಹಂಗೆ ಜಸ್ಟ್ ನಾವು ವಿ ಟೋಲ್ ದ್ಯಾಟ್ ನೀವು ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಫಿಕ್ಸ್ ಮಾಡಬಹುದು ವೆಬ್ಸೈಟಲ್ಲಿ ಹೋಗ್ಬಿಟ್ಟು, ಆ್ಯಂಡ್ ಇಲ್ಲಿ ಕರ್ಕೊಂಡು ಬಂದರೆ ನಾವು ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಬಿಟ್ಟು ನಿಮಗೆ ಹೇಳ್ತೀನಿ ಏನು ನೆಕ್ಸ್ಟ್ ಮಾಡ್ಬೋದು ಅಂತ.
ಮಗು ಮಾತಾಡುತ್ತಾ?
ಮೇಡಮ್ ಮಾತಾಡ್ತಾರೆ, ಅವ್ರು ಮಾತಾಡ್ತಾರೆ, ಅಂದ್ರೆ ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ ಸ್ವಲ್ಪ ಕಷ್ಟಪಡ್ತಾರೆ. ಅಂದ್ರೆ ಕೇಳಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ ನಾವೇನೋ ಕರೆದ್ರೆ ದೂರದಿಂದ ಕರೆದ್ರೆ ಅವ್ರಿಗೆ ಕೇಳಿಸಲ್ಲ, ಆ ತರ
ಓಕೆ
ಪ್ರಾಬ್ಲಮ್ ಇದೆ.
ಸೊ ಮಾತಾಡುವಾಗ್ಲೂನು ಇನ್ನೊಬ್ರದ್ದು ಮಾತನ್ನ ಕೇಳಿಸ್ಕೋಬೇಕಂದ್ರೆ
ಸ್ವಲ್ಪ ತೊದಲ್ಸ್ತಾರೆ.
ಸೊ ಮುಖ ನೋಡ್ಕೊಂಡು ಮಾತಾಡ್ತಾನ ಜಾಸ್ತಿ, ತುಟಿ ಚಲನೆ ನೋಡ್ಕೊಂಡು? ಓಕೆ, ಸರಿ. ಅದಕ್ಕೆ ಇವಾಗ ಅವ್ರು ಹೇಳ್ದಂಗೆನೆ ಈಗಲೇ ನೀವು ಆದಷ್ಟು ಮಗುನ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿದ್ರೆ ಆ ಮಾತಿನ ತೊಂದರೆನೂ ಕೂಡ ಸರಿಪಡಿಸ್ಬೋದು. ಎಷ್ಟೊಂದು ಸತಿ ನಮಗೆ ಸರಿಯಾಗಿ ಕೇಳಿಸ್ತಿರೋದಿಲ್ಲ ಅಲ್ವಾ? ಕೇಳಿಸ್ದೆ ಇರೋದ್ರಿಂದ ಮಗು ಮಾತನ್ನ ಸರಿಯಾಗಿ ಆಡ್ತಿರೋದಿಲ್ಲ. ಅದರ ಡೆವಲಪ್ಮೆಂಟ್ ಹೆಂಗೆ ಆಗಬೇಕು ನಾರ್ಮಲ್ ಆಗಿ ಅಥವಾ ಫ್ಲೂಯೆಂಟ್ ಆಗಿ ಕ್ಲಿಯರ್ ಆಗಿ ಅದಾಗ್ತಾ ಇರೋದಿಲ್ಲ. ಇನ್ನು ಅದಕ್ಕೆ ನಾವು ಏನು ಪರಿಹಾರ ಕಂಡುಕೊಂಡಿಲ್ಲ ಅಂದರೆ ಮುಂದಕ್ಕೆ ಆ ಮಗುಗೆ ಮಾತಲ್ಲೂ ತೊಂದರೆ ಆಗ್ಬೋದು ಮತ್ತು ಶಾಲೆಯಲ್ಲೂ ಕೂಡ ಓದಕ್ಕೆ ಬರೆಯೋಕ್ಕೆ ತೊಂದರೆ ಆಗ್ಬೋದು. ಸೊ ಆದಷ್ಟು ಬೇಗ ನೀವು ತೋರಿಸಿದ್ರೆ ಒಳ್ಳೆಯದು. ಮಗುನ ತೋರಿಸಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿ, ಅಕಸ್ಮಾತ್ ಮಗುಗೇನಾದರೂ ಮಷೀನ್ ಕೊಡಿಸ್ಬೇಕು, ಹಿಯರಿಂಗ್ ಏಡ್ ಕೊಡಿಸ್ಬೇಕು ಅನ್ನೋ ಏನಾದರೂ ಆಪ್ಷನ್ ಇದ್ದರೆ ಅದನ್ನು ಕೊಟ್ಟು ನೀಟಾಗಿ ಒಂದು ಸ್ಪೀಚ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಥೆರಪಿ ಮಾಡಿಸಿ ನಂತರ ಆ ಮಗುನ ನೀವು ನಾರ್ಮಲ್ ಮಗು ಥರ ಆದಷ್ಟು, ಗೊತ್ತಿಲ್ಲ ಎಷ್ಟು ತೊಂದರೆ ಇದೆ ಮಗುಗೆ ಅಂತ, ಅದ್ರ ಪ್ರಕಾರ ನಾವು ಪ್ಲ್ಯಾನ್ ಮಾಡ್ಕೋಬೋದು.
ಓಕೆ
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಚಂದಿ ಮ್ಯಾಮ್, ನೀವು ಮಾತಾಡ್ತಾ ಇದ್ರಿ ಟಾಪ್ ಡೌನ್ ಮತ್ತು ಬಾಟಮ್ ಅಪ್ ಪ್ರೊಸೀಜರ್ಸ್ ಬಗ್ಗೆ. ಒಂದು ಸ್ವಲ್ಪ
Okay. So I just we were talking that when anyone we are communicating, the way we understand is basically through processes. That is a bottom up process and top down process. So bottom up process is something which we normally use when the subject is new to us and we are trying to understand each aspect of the speech. Okay, but if we know something already, okay, if the topic is familiar to us, we normally go for top down approach.
Okay, we'll take the next call. Hello? Hello? Heli?
Sir, my name is Priya.
Yeah?
Actually, I'm calling from my friend. Like, I'm working in an IT sector. Like, my friend is having one problem. Like, he's not having any hearing loss or anything like that. But he studies also well. But the problem is now we all feel like when we talk to him, he is not understanding. Like half of the things he has understanding problem. Like when the boss is telling the procedure of the job also, he focus half of the thing, or he's not he after the thing he's saying like he's not understanding. So we started just searching like what is this, because he keeps doing this thing and he's getting scolding. So we got something regarding processing. So is it is something like really need a treatment, or is it because of his attention, or he is not listening really like that?
How old is the child?
No sir, actually he is not a child. He is 20 years. 20.
Okay.
He's
20
your
year
colleague,
old.
I think, right?
Yes ma'am.
He's your friend.
I can't hear you.
Is he your friend?
Yes, my friend is 20.
Okay.
He is not having any hearing loss, nothing is there. But we checked that also. But he studies also. Academically, nothing problem, nothing is there. But understanding problem is that is the main issue. Like when we tell something also, he won't understand it. He won't listen it properly. In our job also, like he is like he won't do the thing what we are saying.
Okay, just tell me whether do you think that he understands well when you speak to him in quiet situation, and when there's a noise around, his performance goes down?
That thing we have to check. Like normally when we are telling like it is not noisy. Like no normal like situation also he does the same thing only.
And does it improve when he sees your, like when he's doing speech reading, he's looking at your face and understanding? Does his understanding improves?
No, with speech reading and all, it's not. If you are writing and giving, and if you are with that way, he will understand better. Like we have to give, like do this first, do this second, then he will understand. With
And from when do you think this problem has started?
madam, it's like we are working together now.
Yeah,
like,
yeah.
He is saying he has no problem. He is good to learn everything, but we feel like he has some understanding problems.
Okay.
Good problem he is there.
And everything, other aspect, he's fine according to you?
Other aspect, everything he is fine. But if we are giving a set of jokes from the boss, but he won't understand the way, what way he has to do. He will every time he will do the mistake. Like whenever we are talking also he won't understand like what we are talking. We have to keep repeat the thing again and again.
Okay. So looks like it might not be processing deficit, because if it was a processing deficit, it would have been shown earlier also in his school performances. Okay, but we do have patients who there can be some neural deficit which could lead to these kind of problems, but and therefore in them also the hearing might be normal. It could be only speech understanding which would be affected in them.
Okay.
Okay, so as we said, maybe if you are in Mysore, you can get them here and we can do a detailed assessment to see, to confirm what the problem is, and then we can see what management can be done. Looks like a
And the
neural.
main problem is, ma'am, the final part of the sentence. Like if a sentence, they will be telling the final part. That part he will miss.
Okay. I'm understanding. It looks like, to me, it looks like a neural deficit, wherein the hearing is normal but understanding is affected. But to confirm it, it's always better that you come here and we can do a detailed evaluation on him. If you can counsel him and get him here.
Okay, okay, ma'am.
Okay.
Okay, okay, ma'am.
Yeah.
Any other questions?
No, nothing.
Okay, thank you. Okay, you're talking about the top-down and bottom-up processes. In children, how do we identify if if a child has any such problems? What are the different markers? What are the different indications that a child has a problem?
Okay, so in school, the child, Dr. Jayashree also said that you might feel that the child is having a selective hearing loss. So selective hearing loss in the sense you might feel sometimes child is hearing, sometimes child is not hearing. Okay, and he'll be having problem in note taking. Okay, and if the teacher gives 2 or 3 instructions at the same time, I'll just complete that. For example, if a teacher says, open your English notebook, page number 9, line 3, child will just totally go blank.
Okay, we'll take this call. Hello? Hello?
Hello?
Yeah?
Hello, sir. Hello?
Hello?
ಸರ್ ನಾವಿಲ್ಲಿ ಬ್ಯಾಂಗ್ಳೂರಿಂದ ಮಾತಾಡ್ತಾ ಇರೋದು.
ಹೇಳಿ.
ಸರ್ ಮಗು ಬಗ್ಗೆ ಕೇಳಬೇಕಾಗಿತ್ತು ಸರ್.
ಹೇಳಿಪ್ಪ.
ವಿಶಾಂಕ್ ಅಂತ ಮಗನ ಹೆಸರು.
ಓಕೆ.
ಸೊ ಹೌ ವಿಲ್ ಬಿ ಪ್ರಿವೆಂಟ್ ದ ಹಿಯರಿಂಗ್ ಲಾಸ್? ಅಂದ್ರೆ ಅದು ಜಾಸ್ತಿ ಆಗುತ್ತಾ ಅಥವಾ ಕಡಿಮೆ ಆಗುತ್ತಾ? ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಅಲ್ವಾ? ಸೊ ಅದನ್ನ ಹೆಂಗೆ ಪ್ರಿವೆಂಟ್ ಮಾಡೋದು? ಸೊ ಆಲ್ರೆಡಿ ಅವ್ನಿಗೆ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಇದೆ. ಸೊ ಅದನ್ನ ಹೆಂಗೆ ಪ್ರಿವೆಂಟ್ ಮಾಡೋದು? ಅಂದ್ರೆ ಜಾಸ್ತಿ ಆಗದರೆ ಹಾಗೆ ನೋಡ್ಕೊಳ್ಳೋದು ಹೇಗೆ?
ಮಗುಗೆ ಟೆಸ್ಟ್ ಮಾಡಿಸಿ ಆಗಿದೆ ಅಲ್ವಾ?
ಟೆಸ್ಟಿಂಗ್ ಎಲ್ಲ ಮಾಡಿಸಿದೀವಿ. ಆಯುಷಲ್ಲೇ ಅವನ್ಗೆ ಥೆರಪಿ ಎಲ್ಲ ಮುಗ್ದಿದೆ. 5 years ಎಲ್ಲ ಆಗಿದೆ. ಈಗ ಬ್ಯಾಂಗ್ಳೂರಲ್ಲೇ ನಾರ್ಮಲ್ ಸ್ಕೂಲಿಗೆ ಹೋಗ್ತಾ ಇದ್ದಾನೆ.
ಓಕೆ.
ಓಕೆ. ಈಗ ಅಂದ್ರೆ ಕೆಲವೊಂದು ಈಗ ಅವನ್ಗೆ ಲೆಫ್ಟ್ ಸೈಡ್ ತುಂಬಾ ಲಾಸ್ ಜಾಸ್ತಿ ಇದೆ. ಸೊ ರೈಟ್ ಸೈಡು ಕೇಳಿಸ್ಕೊತಾನೆ. ಬಟ್ ಲೆಫ್ಟ್ ಸೈಡಿಗೆ ಏನಾದ್ರು ಕಾಕ್ಲಿಯರ್ ಮಾಡೋ ಅಷ್ಟು ಇದು ಇದೆಯಾ, ಚಾನ್ಸಸ್ ಇದೆಯಾ ಅನ್ನೋದನ್ನ ಸ್ವಲ್ಪ ಡಿಸ್ಕಸ್ ಮಾಡಬೇಕಾಗಿತ್ತು.
ಓಕೆ. he is doing well with the hearing aid, right? Because normal school ಗೆ ಹೋಗ್ತಾ ಇದ್ದಾನೆ ಅಂತ ನೀವು ಹೇಳ್ತಾ ಇದ್ದೀರಲ್ಲ?
ಎಸ್ ಮ್ಯಾಮ್, ಎಸ್ ಮ್ಯಾಮ್. ಹಿ ಇಸ್ ಇನ್ ನಾರ್ಮಲ್ ಸ್ಕೂಲ್.
ಓಕೆ.
ಬಟ್ ಅದು ಹೆಂಗೆ ಅಂದ್ರೆ, ಸೊ ಇವಾಗ ಅವ್ನಿಗೆ ತುಂಬಾ ಅಲ್ಲಿ ಕಾಂಪ್ಲಿಕೇಟೆಡ್ ಆಗ್ತಾ ಇದೆ. ಸೊ ಈಗ ನೀವು ನೋಡಿದಾಗೆ ಮೈಸೂರಲ್ಲಿ ಮಕ್ಕಳುಗಳು ತುಂಬಾ ಕಡಿಮೆ ಕ್ಲಾಸಸ್ಗಳಲ್ಲಿ 30 to 35 ಇರ್ತಾರೆ. ಬಟ್ ಇಲ್ಲ ನಂಗಲ್ಲ, ಒಂದೊಂದ್ ಕ್ಲಾಸ್ಗೆಲ್ಲ 40-45 ಇರ್ತಾರೆ.
ಓಕೆ.
ಅವ್ನಿಗೆ ಹೇರಿಂಗ್ ಏಡು ಸಾಕಾಗ್ತಿಲ್ಲ ಅಂತ ಅನ್ನಿಸ್ತಾ ಇದೆ. ಕೆಲವೊಂದ್ಸರಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಾನೆ, ಕೆಲವೊಂದ್ಸರಿ ರೆಸ್ಪಾಂಡ್ ಆಗಲ್ಲ. ಹಾಗಿದ್ರೆ ಕಾಕ್ಲಿಯರ್ ಮಾಡಿಸೋದ್ರಿಂದ ಏನ್ ಬೆಟರ್? ಅವ್ನಿಗೆ ಹಿಯರಿಂಗ್ ಇನ್ನೂ ಸ್ವಲ್ಪ ಆಗುತ್ತಾ ಅಂತ ನಂದು ಒಂದು ಇದೆ. ಸೊ ಅದಕ್ಕೆ ನಿಮ್ ಸಜೆಷನ್ಸ್ ಏನು ಮೇಡಮ್?
ಓಕೆ, ಕಾಕ್ಲಿಯರ್ ಇಂಪ್ಲಾಂಟ್ ಆಕ್ಚುಲಿ 2 ಕಿವಿಯಲ್ಲಿ ಲಾಸ್ ಜಾಸ್ತಿ ಇರುವಾಗ ನಾರ್ಮಲಿ ನಾವು ರೆಕಮೆಂಡ್ ಮಾಡ್ತೀವಿ. ಓಕೆ, ಸೊ ದಟ್ ಇಸ್ ಅ ಐಡಿಯಲ್ ಸಿಚುವೇಶನ್. ಆವಾಗ ಕಾಕ್ಲಿಯರ್ ಇಂಪ್ಲಾಂಟ್ ಮಾಡ್ಬೋದು. ಮತ್ತೆ ನೀವು ಹೇಳ್ತಾ ಇದ್ದೀರಾ ರೈಟ್ ಇಯರ್ ಅಲ್ಲಿ ತೊಂದರೆ ಕಡಿಮೆ ಇದೆ ಆ್ಯಂಡ್ ಹಿಯರಿಂಗ್ ಏಡ್ ಅಲ್ಲಿ ಯೂಸ್ ಆಗ್ತಾ ಇದೆ ಅಂದರೆ ಐ ಥಿಂಕ್ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೋದು ಹಿಯರಿಂಗ್ ಏಡ್ ಓನ್ಲಿ. ಬಟ್ ನಾವು ಒಂದ್ಸರಿ ಟೆಸ್ಟ್ ಮಾಡ್ಬೋದು ಲೆಫ್ಟ್ ಇಯರ್ ಅಲ್ಲಿ ಹಿಯರಿಂಗ್ ಏಡ್ ಅಲ್ಲಿ ಯೂಸ್ ಇದೆಯಾ ಇಲ್ವೋ ಅಂತ. ಆಯ್ತಾ? ಅದ್ ನೋಡಾದ್ಮೇಲೆ ಈ ಡಿಸಿಷನ್
ಹೆಂಗೆ ಮೇಡಮ್ ಪ್ರಿವೆಂಟ್ ಮಾಡೋದು? ಸೊ ನಮ್ದು ಆಕ್ಚುಲಿ ನಮ್ದು ಇದು ಮ್ಯಾರೇಜ್ ಸಂಬಂಧದಲ್ಲಿ ಮದ್ವೆನೂ ಅಲ್ಲ, ಏನಿಲ್ಲ. ಬಟ್ ಈಗ ನೆಕ್ಸ್ಟ್ ನಾವು ಬೇಬಿ ಮಾಡ್ಕೋಬೇಕು ಅಂದ್ರೆ ಸೊ ಹೇರಿಂಗ್ ಲಾಸ್ ನ ಹೆಂಗೆ ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೋದು? ಸೊ ಈಗ ಆಲ್ರೆಡಿ ನಮಗೆ ಫಸ್ಟ್ ಚೈಲ್ಡ್ ಇದೆ. ಸೊ ಸೊ ಸೆಕೆಂಡ್ ಚೈಲ್ಡ್ ನಾವು ಅದನ್ನ ಹೆಂಗೆ ನಾವು ಅದನ್ನ ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೋದು, ಅಂದ್ರೆ ಬರ್ದಂಗೆ ಹೆಂಗೆ
ಅದು
ಪ್ರಿಕಾಷನ್ಸ್ ತಗೋಬಹುದು ಅಂತ.
ಅದು ಪ್ರೆಗ್ನೆನ್ಸಿ ಟೈಮಲ್ಲಿ ಪ್ರಿಕಾಷನ್ಸ್ ತಗೊಂಡ್ರೆ ಆಗ್ಬೋದು. ಫಸ್ಟ್ 3 ಮಂತ್ಸಲ್ಲಿ ನಿಮಗೆ ಏನು ಆಗಲ್ಲ ಅಂದರೆ ಚಾನ್ಸಸ್ ಕಡಿಮೆ ಇರುತ್ತೆ. ಬಟ್ ನೀವು ಚಾನ್ಸಸ್ ಅಂದರೆ ಅದು ಹೇಳೋಕ್ಕೆ ತುಂಬ ಕಷ್ಟ, ಬಿಕಾಸ್ ಅದಕ್ಕೆ ಜೆನೆಟಿಕ್ ಟೆಸ್ಟಿಂಗ್ ಎಲ್ಲ ಆಗಬೇಕು ಆಯಿತಾ. ಜೆನೆಟಿಸ್ಟ್ ಕ್ಯಾನ್ ಟೆಲ್ ಯು ವಾಟ್ ಆರ್ ದ ಚಾನ್ಸಸ್ ದಟ್ ದ ಸೆಕೆಂಡ್ ಚೈಲ್ಡ್ ಆಲ್ಸೋ ಮೈಟ್ ಹ್ಯಾವ್ ಅ ಹಿಯರಿಂಗ್ ಲಾಸ್. ಓಕೆ
ನೀವೇನು ಹೇಳ್ತಾ ಇದ್ದೀರಾ, ಸೊ ಜೆನೆಟಿಕ್ ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡ್ತಿದ್ರೆ ಅದರಿಂದ ಏನಾದರೂ ಇನ್ಫಾರ್ಮೇಶನ್ ಗೊತ್ತಾಗುತ್ತೆ.
ಎಸ್ ಎಸ್
ಬಟ್ ಸ್ಟಿಲ್ ಅದು ಕಾಷನ್ ಅದು, ಯಾಕಂದ್ರೆ ಇಟ್ಸ್ ಓನ್ಲಿ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಚಾನ್ಸಸ್ ಆಯ್ತಾ. ಸೊ ಆ ಚಾನ್ಸಸ್ ಅಲ್ಲಿ ಎಷ್ಟು ಖಚಿತವಾಗಿ ಪ್ರಾಬ್ಲಮ್ ಬಂದೇ ಬರುತ್ತೆ ಅಂತ ಅವರು ಕೂಡ ನಿಮ್ಗೆ ಹೇಳಕ್ ಆಗೋದಿಲ್ಲ, ಗೊತ್ತಾಯ್ತಾ. ಸೊ ಆದಷ್ಟು ಬೇರೆ ಪ್ರಿವೆಂಟಿವ್ ಕಂಡೀಷನ್ಸ್, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಿಮ್ಗೆ ನಿಮ್ಮ ಫ್ಯಾಮಿಲಿ ಬ್ಯಾಕ್ ಗ್ರೌಂಡ್ ಅಲ್ಲಿ ಏನಾದರೂ ಹಿಯರಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇತ್ತಾ ಅದೊಂದು ನೋಡ್ಕೋಬೇಕು. ಆಮೇಲೆ ನಿಮ್ಮ ಪ್ರೆಗ್ನೆನ್ಸಿಯಲ್ಲಿ ಏನು ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಆಗಬಾರ್ದು, ನ್ಯೂಟ್ರಿಷನ್ ಸರಿಯಾಗಿ ತಗೊಳ್ತಾ ಇರಬೇಕು. ಆಮೇಲೆ ಯಾವ್ಯಾವ ಟೈಮಲ್ಲಿ ನಿಮಗೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ನು ಅಥವಾ ಟೆಸ್ಟಿಂಗು ಅದೆಲ್ಲ ಅಲ್ಟ್ರಾಸೌಂಡ್ ಎಲ್ಲ ಮಾಡಿಸ್ಬೇಕು, ಅದನ್ನೆಲ್ಲ ನೋಡಿ ಮಗುವಿನ ಕಂಡೀಷನ್ ಹೇಗಿದೆ ಅದನ್ನು ನೋಡ್ಕೋಬೇಕು. ಸ್ಟ್ರೆಸ್ ಫ್ಯಾಕ್ಟರ್ಸು, ಇದನ್ನೆಲ್ಲ ಕೆಲವು ಪ್ರಿವೆಂಟಿವ್ ಮೆಷರ್ಸ್ನ ಅದ್ರ ಜೊತೆಗೆ ನೀವು ಮಾಡಿದ್ರೆ ಒಳ್ಳೇದು ಅಂತ ಹೇಳ್ಬೋದು. ಬಟ್ ಅದರ್ವೈಸ್ ನೀವು ಜೆನೆಟಿಕ್ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿದ್ರೂ ಕೂಡ ಅದು ಚಾನ್ಸಸ್ ಎಷ್ಟು ಅಂತ ಮಾತ್ರ ಅವ್ರು ಹೇಳ್ತಾರೆ. ಸೊ ಹಂಗಂತ ಆಮೇಲೆ ಆ ಮಗುಗೆ ತೊಂದರೆ ಆದ ತಕ್ಷಣ ನೀವು ಅವ್ರಿಗೆ ಹೋಗ್ಬಿಟ್ಟು ಮತ್ತೆ ಇದು ಮಾಡೋಕ್ಕಾಗೋದಿಲ್ಲ ಅಲ್ವಾ. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ಅದೊಂದು ಕಾಷನ್ ಹೇಳಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ ನಾನು.
ಓಕೆ ಮ್ಯಾಮ್, ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ದ ಆನ್ಸರಿಂಗ್ ಆಲ್ ದ ಕ್ವೆಶ್ಚನ್ಸ್.
Thank you. Dr. Chan, you were talking about the different indications and signs and
Yeah,
symptoms.
so I was one example which I told you, like that they might, when the teacher is giving them an instruction, they might find it difficult. That is, if they give 2 to 3 sentences at a time, they will go totally blank. Okay, and just
Okay.
remind me to tell about Tarizami in the
Okay.
next class.
Hello? Hello?
Hello, sir.
Really?
Hello, sir. I'm from Mumbai.
Yeah?
I have a question regarding my son. We
Yeah?
have been struggling for our son very much. He was diagnosed as learning disability when he was in 2nd grade, but till then he had just the problems of reading and writing, and school performance was weak for him. But now we have come across lots of problems. He's not, whenever we talk, whenever we say something, there's difficulty in understanding for him. He doesn't recall many things, so we are very much worried about him, sir. Is it related, or is there any other problem?
So yeah, I think more or less you've given us some idea about the child. We've already been discussing about this from the beginning of the program, that one thing is there are a lot of children who can have everything normal, in the sense their vision is normal, their hearing is normal, their IQ is fine. Okay, still they don't understand the information. Okay, so that is when we are suspecting that these kids can have processing issues. Okay, so we've seen the same, it's not just with auditory processing, but it's also true for visual processing. So their vision will be fine, or they have a corrected vision, but still you'll see that the children are not understanding what they're writing. Okay, the same is true with auditory processing problems also. So what it really requires, see, if I'm hinting at learning disability from this, I don't know whether this child is learning disability as of now, just from the information that you have given. He will require a thorough assessment from a team of professionals. But otherwise also, if we presume that this child has learning disability, you should remember that the child is having a condition. It is not that the child is faking, the child is not lazy, okay? So it's just that the child will probably require somebody to understand his problem, okay? And moreover, what we've seen is in a lot of these children with learning disability, there's an associated central auditory processing disorder, or you could even call it as auditory processing disorder. But for all of this, you have to kind of rule out whether his IQ is fine, okay, whether his vision is fine. So you have to get an ophthalmological evaluation also done. You have to make sure that his motor development is appropriate. Make sure that he doesn't have behavioral issues.
What happened was, in our locality there is a clinic, psychological clinic. They have a huge board of learning disability. So we took our child to there. The psychologist, he wrote learning disability before, but now when I send my son to shop, if I say 4 items to bring, he just remembers 2 items, forgets rest those. What we are really worried what
So-
type of problem my son has.
So exactly. So you already know the problem. That's what I'm trying to tell you, that the child has learning disability. In fact, just before this, Dr. Chandni was just mentioning that she wanted to talk about Tare Zameen Par. So I'm sure since you are from Mumbai, I'm very sure that you know about this movie called Tare Zameen Par, wherein if you see the child actually is kind of normal in everything else except when it comes to reading and writing. You can actually see how beautifully it has come out, the whole movie. He sees the letters in a very different way. He sees the letters flying around. He kind of does not follow the instructions in the classroom, but otherwise he's absolutely fine outside. He's kind of watching movies, and he's playing very well, so everything else is fine in this child. But the whole thing is not just about diagnosing the child with learning disability. I think you also have to go in for some form of management or rehabilitation, as we would say. So you will require the help from your psychologist. You will also probably require help from speech language pathologist. And suppose he has an auditory processing problem, you will have to take help from the audiologist also. So basically, it's going to be more of a teamwork to help this child. So I think that is something that you have to gear up for. And as far as I know, I think the Maharashtra Dyslexia Association is doing a great job. So you could get some help with the Maharashtra Dyslexia Association. They will help. In fact, they also have an extended version of that, wherein they help them with vocational training also, especially severe children with learning disability who are not able to do so good in their academic skills. So there's definitely some option. You have to go to the right people, right professionals. Okay.
Thank you.
I hope that answered your question.
Thank you. Okay, Dr. Chandni. Tare Zameen Par.
Dr. Jayashree just now told that I assume that all of you would have seen that movie. So in that movie, this child is actually, parents think that the child doesn't want to learn, right? And he has been put up into boarding because they think that he's not doing well. But the teacher there, when he is understanding his actual situation and he's working specifically on those areas, you can see that the child has started doing well. So it is just that we need to identify the areas in which the child is having problem, and working exactly on that, it's going to help. Okay. And specifically for LD as well as CAPD, the teachers play a very important role, because it is only after 7 years, that is at around first standard, the child is going to get identified.
We'll take the next call. Hello? Hello?
ಹಲೋ
ಹೇಳಿ.
ಸರ್ ನಮಸ್ತೆ, ನನ್ನ ಹೆಸರು ಮೇಘನಾ ಅಂತ.
ಹೇಳಿ.
ಸರ್, ನಮ್ಮ ನೈಬರ್ ಅಲ್ಲಿ ಒಬ್ಬ ಹುಡುಗಂಗೆ ಇಶ್ಯೂ ಇತ್ತು, ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಕೇಳೋಣ ಅಂತ ಕಾಲ್ ಮಾಡಿದೆ.
ಹೇಳಿ, ಏನಾಗಿತ್ತು?
ಸರ್, ಅಂದ್ರೆ ಲೈಕ್ ಹುಡುಗಂಗೆಲ್ಲ ನಾರ್ಮಲ್ ಆಗಿ ಓದ್ತಾನೆ ಎಲ್ಲ ಮಾಡ್ತಾನೆ, ಬಟ್ ಸ್ವಲ್ಪ ಕೇಳೋದಿಲ್ಲ. ಲೈಕ್ ತುಂಬಾ ಆಫನ್ ಆಗಲ್ಲ, ಬಟ್ ಸಮ್ಟೈಮ್ಸ್ ನಮ್ಗೆ ಅದು ಗೊತ್ತಾಗುತ್ತೆ, ಅವ್ರಿಗೆ ಸರಿಯಾಗಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡಲ್ಲ. ಅಂಡ್ ಓದೋದ್ರಲ್ಲೂ ಸ್ವಲ್ಪ ಹಿಂದೆ ಇದ್ದಾರೆ.
ಓಕೆ, ಎಷ್ಟು ವಯಸ್ಸು ಮಗುಗೆ?
7th ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಈಗ.
ಓಕೆ, ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಸಿದಾರಾ?
ಸರ್, ಅಂದ್ರೆ ನನ್ನ ನೈಬರ್ ಅಲ್ಲ, ಅವ್ರು ಹೇಳ್ತಿರ್ತಾರೆ, ಹಾಗಾಗಿ ನಂಗೆ ಇದ್ರ ಬಗ್ಗೆ ಗೊತ್ತಿರೋದ್ರಿಂದ ನಾನು ಕಾಲ್ ಮಾಡಿ ಕೇಳಿ ಏನ್ ಪ್ರೊಸೀಜರ್ ಅಂತ. ಅವ್ರು ಟೆಸ್ಟ್ ಮಾಡಿಸಿದಾರೆ ಏನೋ ಅಷ್ಟು ಗೊತ್ತಿಲ್ಲ.
ಈಗ 7th ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಅಂತ ಹೇಳಿದ್ರಿ ಅಲ್ವಾ ನೀವು? ಮೊದಲನೇದಾಗಿ ನಾನು ಹೇಳೋದೇನೆಂದ್ರೆ, ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಸಿ, ಆಯ್ತಾ? ಇನ್ ಎನಿ ಕೇಸ್, ಯಾಕಂದ್ರೆ ಅದು ಡಿಟೆಕ್ಟ್ ಮಾಡೋದು ಬರೀ ಅಲ್ಲಿ ಕಣ್ಣಿಗೆ ಕಾಣಿಸೋ ಅಂಥದ್ರಿಂದ ಡಿಟೆಕ್ಟ್ ಮಾಡೋದು ಕಷ್ಟ. ಅಂದರೆ ನೀವು ಅಷ್ಟು ಒಬ್ಸರ್ವ್ ಮಾಡಿರ್ಲಿಕ್ಕಿಲ್ಲ ಅಂತ ನಾನು ಅನ್ಕೊಳ್ತೀನಿ. ಬಟ್ ಪ್ರೊಫೆಷನಲ್ಸ್ ಏನು ಮಾಡ್ತಾರಂದ್ರೆ ಆ ತೊಂದರೆನ ಬೇರೆ ಬೇರೆ ಲೆವೆಲ್ಸಲ್ಲಿ ಪರೀಕ್ಷೆ ಮಾಡ್ತಾರೆ. ಸೊ ಈಗಾಗಲೇ ನಾವು ಹೇಳ್ತಾ ಇದ್ವಿ, ನಿಮ್ಮ ಮುಂಚೆ ಒಬ್ರು ಕಾಲ್ ಮಾಡಿದಾಗ ಈಗ ಕೈಕಾಲು ಶಕ್ತಿ ಸರಿಯಾಗಿದೆಯಾ, ಸರಿಯಾದ ಕೈಕಾಲು ಶಕ್ತಿ ಸರಿಯಾಗಿರೋದು ಅಷ್ಟೇ ಅಲ್ಲ, ಯಾವ ವಯಸ್ಸಿಗೆ ಆ ಮಗು ನಡೆಯಕ್ಕೆ ಪ್ರಾರಂಭ ಮಾಡ್ತು ಅಥವಾ ತೆವಳ್ಕೊಂಡು ಹೋಗೋದು ಪ್ರಾರಂಭ ಮಾಡ್ತು ಅನ್ನೋದು ನಾವು ನೋಡಬೇಕು. ಅಂದರೆ ಅದನ್ನು ಮೋಟಾರ್ ಮೈಲ್ ಸ್ಟೋನ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಅದನ್ನು ಚೆಕ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ವಿಷನ್ ಸರಿಯಾಗಿದೆಯಾ, ಕಣ್ ಕಾಣಿಸೋದು ಸರಿಯಾಗಿದೆಯಾ. ಯಾಕಂದರೆ ಎಷ್ಟೊಂದು ಸತಿ ನಮ್ಮಲ್ಲೂ ಕೂಡ ಬರುವಂಥ ಮಕ್ಕಳಿಗೆ ಆ್ಯಕ್ಚುಲಿ ವಿಷನ್ ಪ್ರಾಬ್ಲಮ್ ಇಂದ ಅವ್ರಿಗೆ ಓದಕ್ಕೆ ಬರೆಯೋಕೆ ಆಗ್ತಿರಲ್ಲ. ಸೊ ಅವರು ಏನೋ ಲರ್ನಿಂಗ್ ಡಿಸೆಬಿಲಿಟಿ ಇದೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ನಮ್ಮ ಹತ್ರ ಕರ್ಕೊಂಡು ಬಂದಿರ್ತಾರೆ. ಸೊ ನಾವು ಸಿಂಪಲ್ ಆಗಿ ಏನಿಲ್ಲ, ಫಸ್ಟ್ ಅವ್ರನ್ನ ಆಪ್ಥಲ್ಮಾಲಜಿಗೆ ಕಳಿಸ್ಬಿಟ್ಟು ಒಂದು ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ತೀವಿ. ಮಾಡಿಸಿದಾಗ ಆ ಮಗು ಸ್ಪೆಕ್ಸು ಅದೆಲ್ಲ ಕರೆಕ್ಟೆಡ್ ವಿಷನಿಂದ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾ ಇರುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ನಾವು ಸುಮ್ಮನೆ ಡೈರೆಕ್ಟಾಗಿ ಒಂದು ಕನ್ಕ್ಲೂಷನ್ಗೆ ಬರೋದು ತಪ್ಪಾಗ್ಬಿಡುತ್ತೆ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ದೇನೆ. ಜೊತೆಗೆ ಕಿವಿ ಪರೀಕ್ಷೆನೂ ಮಾಡಿಸ್ಬೇಕಾಗತ್ತೆ, ಆಯಿತಾ. ಕಿವಿ ಪರೀಕ್ಷೆನೂ ಎಷ್ಟೊಂದು ಸತಿ ನಾವು ಇಲ್ಲೂ ನೋಡಿದ್ದೀವಿ, ಮೇ ಬಿ ಚಾಂದ್ನಿ ಅವರು ಹೇಳ್ತಾರೆ ಅದ್ರ ಬಗ್ಗೆ. ಕಿವಿ ಪರೀಕ್ಷೆಯಲ್ಲಿ ಆ ಮಗುಗೆ ಮೈಲ್ಡ್ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಎಲ್ಲ ಇರುತ್ತೆ, ಆಯ್ತಾ. ಅಂದ್ರೆ ಆ ಮಗು ಜೋರಾಗಿ ಮನೇಲಿ ಮಾತಾಡಿದಾಗ ಅದು ಕೇಳಿಸ್ತಾ ಇರುತ್ತೆ, ಆದ್ರೆ ಸ್ವಲ್ಪ ನಾರ್ಮಲ್ ಕಾನ್ವರ್ಸೇಷನ್ ಲೆವೆಲ್ಲು ಅದಕ್ಕೆ ಕೇಳಿಸ್ತಾ ಇರೋದಿಲ್ಲ. ಸೊ ಅದರಿಂದ ಓದಕ್ಕೆ ಬರೆಯೋಕ್ಕೆ ತೊಂದರೆ ಆಗ್ತಿರುತ್ತೆ ಮಗುಗೆ. ಸೊ ಅಂಥದ್ದೆಲ್ಲ ಅನ್ಡಿಟೆಕ್ಟ್ ಆಗ್ಬಿಡುತ್ತೆ. ಸೊ ಅದನ್ನ ಕೂಡ ನಾವು ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕು. ಇದ್ರ ಹೊರತಾಗೂ ಕೂಡ ಕಿವಿ ಪ್ರಾಬ್ಲಮ್ಮು ಇಲ್ದೇನೆ, ಅಂದ್ರೆ ಥ್ರೆಶೋಲ್ಡ್ಸ್ ಎಲ್ಲ ನಾರ್ಮಲ್ ಇದ್ರೂ ಕೂಡ ಈ ಮಗುಗೆ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದ್ರಲ್ಲಿ ತೊಂದರೆ ಇರ್ಬೋದು. ಅಂಥ ತೊಂದರೆನೂ ಕೂಡ ನಾವಿಲ್ಲಿ ಪರೀಕ್ಷೆ ಮಾಡ್ತೀವಿ. ಅದ್ರ ಬಗ್ಗೆ ನಾವು ಮಾತಾಡ್ತಿದ್ವಿ ಹೆಚ್ಚಾಗಿ, ಆಡಿಟ್ರಿ ಪ್ರಾಸೆಸಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಅಂತ. ಅದನ್ನ ನೋಡ್ಕೋಬೇಕಾಗತ್ತೆ. ಮಗು ಮಾತು ಯಾವಾಗ ಕಲ್ತ್ಕೊಳ್ತು, ಅಥವಾ ಮಗು ಸರಿಯಾಗಿ ಮಾತಾಡ್ತಾ ಇದೆಯಾ, ಅಂದರೆ ಆ ಮಗುವಿಗೆ ಇರೋವಂಥ ವಯಸ್ಸಿಗೆ ಶಬ್ದಕೋಶ ಸರಿಯಾಗಿದೆಯಾ, ವೊಕ್ಯಾಬ್ಲರಿ ಸರಿಯಾಗಿದೆಯಾ, ಅಥವಾ ಆ ಮಗು ವಾಕ್ಯಗಳಲ್ಲಿ ಮಾತಾಡ್ತಾ ಇದೆಯಾ. ಎಷ್ಟೊಂದು ಬಾರಿ ನಾವು ನೋಡಿದ್ದೀವಿ ಈ ಮಕ್ಕಳನ್ನ. ನಾವು ಈಗ ನೀನು ಏನು ಊಟ ಮಾಡಿದೆ ಅಂದ ತಕ್ಷಣ ಆ ಮಗು ಚಪಾತಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಬಿಟ್ಬಿಡುತ್ತೆ. ಆದರೆ 7ನೇ ಕ್ಲಾಸ್ ಮಗು ಅಷ್ಟಕ್ಕೆ ನಿಲ್ಲಿಸಲ್ಲ. ಸೊ ನೀವು ಕೇಳಿದ್ರೆ ಏನು ತಿಂದೆ, ನಾನಿವತ್ತು ಚಪಾತಿ ತಿಂದೆ ಮತ್ತು ಅದ್ರ ಜೊತೆ ಪಲ್ಯ ತಿಂದೆ, ಆಮೇಲೆ ಅನ್ನ ಸಾರು, ಆ ಥರ ಒಂದು ವಾಕ್ಯದಲ್ಲಿ ಮಾತಾಡುತ್ತೆ. ಅದನ್ನು ನಾವು ಪ್ರೊಫೆಷ್ನಲ್ಸ್ ಅದನ್ನು ಒಬ್ಸರ್ವ್ ಮಾಡಿ ನೋಟ್ ಮಾಡ್ತೀವಿ. ಈ ಲರ್ನಿಂಗ್ ಡಿಸೆಬಿಲಿಟಿ ಮಕ್ಕಳು, ಅದರಲ್ಲೂ ಮಾತಿನ ತೊಂದರೆ ಇರುವಂಥ ಮಕ್ಕಳು ಅಥವಾ ಡಿಲೇ ಇರುವಂಥ ಮಕ್ಕಳು ಸಾಮಾನ್ಯವಾಗಿ ಒಂದು ಪದವನ್ನು ಉಪಯೋಗಿಸ್ಕೊಂಡು ಮುಗಿಸ್ಕೊಂಡು ಬಿಡ್ತಾರೆ. 7ನೇ ಕ್ಲಾಸು ಅಂದರೆ ಆ ಮಗು ಆಲ್ಮೋಸ್ಟ್ ನೀವು ಒಂದು 12 ವರ್ಷಕ್ಕೆ ಹತ್ತತ್ರ 11-12 ವರ್ಷದ ಮಗು ಅದು. ಸೊ ಅಷ್ಟರೊಳಗೆ ಎಲ್ಲ ಭಾಷೆಯ ಬೆಳವಣಿಗೆ ಆಗಿರಬೇಕು, ಗೊತ್ತಾಯ್ತಾ. ಸೊ ಅದಾಗಿಲ್ಲ,
ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, ಹೇಳೋದು ತುಂಬಾ ಕಡಿಮೆ. ನಾವ್ ಅನ್ಕೊಂಡ್ವಿ ಓದೋದ್ರಲ್ಲೂ ಸ್ವಲ್ಪ ಹಿಂದೆ ಇದ್ದಾರಲ್ಲ, ಹಾಗಾಗಿ ಅದೇನಾದ್ರು ಎಫೆಕ್ಟ್ ಆಗ್ತಿರ್ಬೋದಾ ಅಂತ.
ಹೌದು, ಅದಕ್ಕೆ ಹೇಳ್ತಾ ಇರೋದು ಪರೀಕ್ಷೆ ಮಾಡಬೇಕು. ಪರೀಕ್ಷೆ ಮಾಡಿದ್ರು ಕೂಡ ನಾರ್ಮಲಿ ಮಕ್ಕಳು ಸುಮ್ಮನೆ ಒಂದು ಪದ ಹೇಳ್ಬಿಟ್ಟು ಆನ್ಸರ್ನ ಹೆಂಗೋ ಸ್ಯಾಟಿಸ್ಫೈ ಮಾಡಿಬಿಡ್ತಾರೆ. ಅದು ಲೇಮನ್ಗೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಹಾಗಾಗಿ ಪ್ರೊಫೆಷನಲ್ಸ್ ಹತ್ರ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕು. ಅಲ್ಲೂ ಏನೋ ದೋಷ ಇರೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ ಅಲ್ವಾ. ಓಕೆ.
ಮೈಸೂರಿನವರೇನಾ ನೀವು?
ಅಂದ್ರೆ ನಾನು ಮೈಸೂರು ಅಂತ ಹೇಳ್ತಿರೋದು, ಬಟ್ ನಾನು ಈಗ ಬೆಂಗಳೂರಲ್ಲಿ.
ಹಾಗಾದ್ರೆ ಒಂದ್ಸಲಿ ಇಲ್ಲಿ ಮೈಸೂರಿನಲ್ಲಿ ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಕಳಿಸ್ಕೊಡಿ ಅವ್ರನ್ನ. ಪೂರ್ತಿ ಡೀಟೇಲ್ ಆಗಿ ಟೆಸ್ಟಿಂಗ್ ಆದ್ಮೇಲಿಂದ ಅವರಿಗೆ ಏನು ತೊಂದರೆ ಇದೆ, ಅದಕ್ಕೆ ಹೆಂಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ಅನ್ನೋದನ್ನ ಪೂರ್ತಿ ವಿವರವಾಗಿ ಹೇಳ್ತಾರೆ ಇಲ್ಲಿ. ಸೊ ಅದ್ರ ಮುಂದಕ್ಕೆ ಹೆಂಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡೋದು ಅನ್ನೋದನ್ನ ನೋಡ್ಕೊಳ್ಬೋದು.
ಓಕೆ, ಖಂಡಿತ ಸರ್. ಅಂದ್ರೆ ಈಗ ಕಳ್ಸಿಕೊಡೋದಂತ ಹೇಳ್ತೀರಾ? ಈಗ ಟೆಸ್ಟ್ ಮಾಡ್ಸಕ್ ಒಳ್ಳೇದು ಅಂತನಾ?
ಎಷ್ಟು ಬೇಗ ಆಗುತ್ತೋ ಅಷ್ಟು ಬೇಗ ಟೆಸ್ಟ್ ಮಾಡ್ಸೋದಂತೂ ಡೆಫಿನೆಟ್ಲಿ ಒಳ್ಳೇದು.
ಓಕೆ ಸರ್, ಖಂಡಿತ ನಾನು ಅವ್ರು ಕೂಡ ತಿಳಿಸ್ತೀನಿ.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
ಎಲ್ಲರಿಗೂ ಇನ್ನೊಮ್ಮೆ ನಮ್ಮ ವೆಬ್ಸೈಟ್ ಡೀಟೇಲ್ಸ್ ಕೊಟ್ಬಿಡೋಣ. ಯಾಕಂದರೆ ಅವರು ಕೆಲವರು ಅಪಾಯಿಂಟ್ಮೆಂಟ್ಸ್ಗೆ ಹುಡುಕ್ತಿರ್ತಾರೆ, ಇನ್ನು ಕೆಲವ್ರಿಗೆ ಟೆಲಿ ಅಸೆಸ್ಮೆಂಟ್ ಆಪ್ಷನ್ ಇದೆ ಅನ್ನೋದು ಗೊತ್ತಿರೋದಿಲ್ಲ. ಸೊ ನಮ್ಮ ವೆಬ್ಸೈಟ್ www.aishmysore.in aishmysore.in ಅಂತ. ಸೊ ನೀವು ಆ ವೆಬ್ಸೈಟ್ಗೆ ಹೋದರೆ ರೈಟ್ ಹ್ಯಾಂಡ್ ಸೈಡಲ್ಲಿ ನಿಮಗೆ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಡೀಟೇಲ್ಸ್ ಮತ್ತು ಟೆಲಿ ಅಸೆಸ್ಮೆಂಟು, ಟೆಲಿ ರಿಹ್ಯಾಬ್ದು ಡೀಟೇಲ್ಸ್ ನಿಮಗೆ ಸಿಗುತ್ತೆ. ಸೊ ಅದನ್ನು ನೀವು ಅಲ್ಲಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿಬಿಟ್ಟು ಯಾವಾಗ ಬರ್ಬೋದು ಅನ್ನೋದನ್ನು ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಫಿಕ್ಸ್ ಮಾಡಿಕೊಂಡು ನೀವು ನಮ್ಮ ಸರ್ವಿಸಸ್ನೆಲ್ಲ ಅವೈಲ್ ಮಾಡ್ಕೋಬೋದು ಅಂತ ಹೇಳಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ.
ಓಕೆ, ಈಗ ಎಷ್ಟೊಂದು ಜನ ಕಾಲಲ್ಲಿ ಮಕ್ಳಿಗೆ ತೊಂದರೆ ಇದೆ ಅಂತ ಹೇಳಿದ್ರಿ, ಬಟ್ ಆ ತೊಂದರೆನ ಟ್ರೀಟ್ಮೆಂಟ್ ಹೇಗೆ ಮಾಡೋದು? ವಾಟ್ ಆರ್ ದ ಡಿಫ್ರೆಂಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ಸ್ ದಟ್ ದ ಚಿಲ್ಡ್ರನ್ ಹ್ಯಾವ್?
So maybe we can start with auditory, then I'll take over for
Sure.
language skills.
Okay, so as I discussed that these children will, if they have problem in processing, there are various processing as Dr. Jayashree also said that they might have problem in auditory discrimination. They might have problem in auditory closure, that is they might have problem in understanding in the presence of noise. Okay, they also might have problem when they have to hear from both the ears. They might not be able to integrate that information and memory. Okay, so the therapy or the management is in two lines, wherein there are some environmental modifications which is normally done by teachers at the school level and by parents at home level. So you can modify the environment so that it is easier for the child to understand. We'll
Come back to
continue
you.
after the call.
Hello? Hello? ಹೇಳಿ
ಹಲೋ, ನಾನು ಮೈಸೂರಿಂದ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ.
ಹೇಳಿ.
ಫೇಸ್ಬುಕ್ ಪ್ರೋಗ್ರಾಮ್ ಕೇಳಿಸ್ಕೊತಾ ಇದ್ದೆ.
ಓಕೆ.
ಅದರಲ್ಲಿ ನೀವು ಸೆಂಟ್ರಲ್ ಆಡಿಟರಿ ಪ್ರಾಸೆಸಿಂಗ್ ಡಿಸಾರ್ಡರ್ ಅಂತ ಒಂದು ಮೆನ್ಷನ್ ಮಾಡಿದ್ರಲ್ಲ, ನಂಗೆ ಅದ್ರ ಬಗ್ಗೆ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿ ಪ್ಲೀಸ್ ಒಂದು ಸ್ವಲ್ಪ ಡೀಟೇಲ್ ಆಗಿ.
ಓಕೆ.
ನಾನು ಅದೇ ಆ್ಯಕ್ಚುಲಿ ಹೇಳ್ತಾ ಇದ್ದೆ. ಸೆಂಟ್ರಲ್ ಆಡಿಟರಿ ಪ್ರಾಸೆಸಿಂಗ್ ಡಿಸಾರ್ಡರ್ ಅಂದರೆ ಕಿವಿದು ಆ್ಯಕ್ಚುಲಿ we have two functions, that is hearing as well as understanding. Okay, so when we talk about central auditory processing disorder, their peripheral ear, that is their hearing is normal, they will be hearing everything, but when the information goes to the brain they might not understand it. Okay, so that is what is when that happens, that is what is termed as central auditory processing disorder. Okay, and because of that adrinda ಸ್ಕೂಲಲ್ಲಿ ಮಕ್ಕಳಿಗೆ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋಕ್ಕೆ ತುಂಬ ಕಷ್ಟ ಆಗುತ್ತೆ. Okay, they might not be able to understand the instructions given by the teacher. They'll perform poor in all the most of the subjects. They'll have poor memory. They'll be very disorganized because they are not understanding. And parents might think that sometimes he hears, sometimes he doesn't hear, because in quiet situation he might hear well, but when there's a background noise he might not hear well. Okay, so these are some of the features which are seen in central auditory processing disorder. Okay, it's a functional disability. There is no structural abnormality at the brain level. It is just that in function, when it is related to understanding, he is not able to do it well.
Okay.
Is that clear? Or you want to know?
Yeah, I understood.
Okay.
Thank you.
Yeah.
Okay, you were talking about the treatment
Yeah,
options.
so I said that we basically in treatment there are two options, that is we can do environmental modifications which teachers can be counseled, that they can do modification in their teaching, the sitting arrangement if there is a child with central auditory processing disorder. So few modifications I'll just tell you. Few modifications can be, the child can be in the front row. Okay, and as I said, it's better that the teacher doesn't walk and talk. Okay, it's better that the teacher is facing the child and she's talking. Okay, it's also better that teacher doesn't write and talk, that is teacher might be writing at in the blackboard and talking, so that also child might find it difficult to understand. Okay, and it's always better that she breaks the sentences and she says it. She can always for CAPD children also peer partner helps a lot. So teacher can assign a peer partner for the child who is having difficulty, so that peer partner can help in note taking and all other difficulties which the child is having. And even at home the parents can also take care of the same thing, like they should not give him instructions from the other room. Okay, or they need not give him instructions when the TV is on. Okay, or when the child is doing some other mobile, if the child is talking in the mobile and you're talking to him, because he'll find it difficult to perform two listening tasks at the same time. So these are some of the modifications which can be done at home and at school level. Other than that, we do give specific therapy which is done by an audiologist. Okay, that I'll continue after this call.
Hello? Hello?
Hi.
ಹೇಳಿ.
This is Seetal. Actually, ನನಗೆ ಈ ಪ್ರೋಗ್ರಾಮ್ ಬಗ್ಗೆ ಒನ್ ಆಫ್ ದ ಫ್ರೆಂಡ್ ಹೇಳಿದ್ರು.
Okay.
And it's regarding the anyone where the kids who doesn't do eye contact, the kids who doesn't do any proper listening ability. So I'm here actually one of hello.
Yeah, we can hear you.
Am I
Please go on.
audible? Hello?
Yeah, we can hear you. Please
Yeah,
go on.
my son actually doesn't do the eye contact while talking, okay? And he doesn't even listen when I am talking.
Okay.
And another thing is, which I'm facing, he doesn't react to whatever I mean, he will react. Everything is normal, but the thing is, it is, you know what's happening? It is actually, um, hello? Am
Yeah,
I
go on. Please
audible?
go on.
Hello?
Please continue.
Yeah, another thing which I'm facing is uh, he doesn't do eye contact. Is the first thing, and the second thing which I'm facing is trouble is he's actually hyperactive child. He everything is very normal, but the thing is he prolonged to do the brushing and he doesn't want to do it. He doesn't listen to me. Whatever I say, the things which has to happen. ಅಂದ್ರೆ ಯಾವುದೇ ಕೆಲಸ ಇರ್ಬೋದು brushing, ಸ್ನಾನ and all. ಬೇಗ ಆಗಲ್ಲ. You know, I have to request him. Even if I give him a glass of milk, I need 1 hour to feed him. ಓಡೋದು,
Okay.
taste, ಸಖತ್ taste. It's not that he has some problem, but he'll be running around. He doesn't want to take bath. He doesn't want to brush his teeth. He doesn't want to go to school. So this is a problem I'm facing. Even in the online classes, which is happening now, he is 4 years now. Even at the online classes which is happening, he doesn't sit quietly. He doesn't listen to the ma'am what she's instructing. So I need your help with this.
Yeah, Dr. Jayashree can expand on this.
Yeah, I got your problem. See, first of all, 4-year-old, you can't expect him to sit for online classes. Okay, so I'm not a person who will recommend somebody to have this. I don't know if we will sit for so
Hmm?
long. Okay, so I think maybe you should talk to the school and let them know that he's too young to sit so long for an online class. Okay, but apart from that, I absolutely understand your concern on the other side. Okay, he is 4-year-old. You're saying that he takes a lot of time to brush his teeth and do all the activities or listen to you, and he's all the time very hyperactive and so on, isn't it? And he's not making eye contact. So I would not right away label him with anything, but there are some risk factors that you're showing up with. Okay, because eye contact is something we would have definitely expected by 4-year-old child, and if it is not there, it is a red flag for us. But however, what I would like to tell all of you is there are certain children at risk for a condition called as autism spectrum disorders. So I'm telling you again with caution, I am not labeling your child as autism spectrum disorders, because unless and until we evaluate this child, I do not want to label him, but he could be at risk for something. So let's just find out that. Okay, but however, why I'm saying this is for the benefit of the audience who are watching us on FB Live, as well as the others who are listening to us. What happens is, the first concern many parents have is in these children with autism spectrum disorders is, one, that the child is not responding to his name. Okay, I think that's the first thing that children do when they're growing up, and definitely by 4-year-old they should respond, and they have immediate response to any kind of questions that are asked and all of that, and if they're interested, they will definitely respond back. Okay, so they come to us, and it looks like a suspected hearing loss, okay, to all of us. So when they come to our speech OPD, we think that probably this child should be screened for a hearing problem. So we send them for audiological evaluation, and in most see in these children. Another aspect is like eye gaze or eye to eye contact that you said is something that we have to look out for, and the speech language development. Sometimes these children have associated problems with attention. So that this, something like, I would still say that this is all very hazy to me. So I don't want to really give out a label to this child, but I'm just telling you that yes, there is some concern. if some of these things the child is not doing by 4 year. Okay, so you should get an evaluation done, seek a professional's help. He might just be a normal child also, there might be so many other underlying factors wherein we know, we get to know that we sort it in the environment, everything is going to be fine. Okay, so that's why I said the first thing that I said is you can't expect a child to sit for an online class who's 4 year old.
Yeah,
Fine,
that
and
I
then
understand. But you know what happens with another every child is sitting in the class, and only my son is being very
correct.
hyper. It
Yes,
makes me
yes,
also
I
feel
do
odd.
understand. I
But
do
yeah,
understand. I do understand that concern. That's why I'm saying that you should get an evaluation. I still see some risk. I still see some concern. Get him evaluated. Okay. And then probably will guide you what has to be done after that.
all right.
Yeah. Okay. I hope that
Yeah,
was.
but where I have to come?
If you can, you're from Bangalore, right?
No, I'm from Mysore.
Mysore Aish is very much here in Mysore. It's in Manasa Gangotri. Okay,
Okay.
you can come over to us and get his evaluation done. We are doing evaluations now offline, so you could just
Okay.
come, bring him one day, or seek an
Okay.
appointment and get the evaluations done.
What's the timing?
You can go to our website,
Hmm?
okay, which is www.aiishmysore.in, aishmysore.in, and on the right hand side you will get the information for that.
All right.
Okay,
The
yeah,
timings and all, no?
yes,
All right. Thank you so much. I'll personally meet and discuss because orally we may discuss so many things, but then
correct,
the thing, if
yes,
you observe him, you may get to know
exactly,
better because,
right.
and yeah, we are, I mean, counseling, we are trying our best to make him correct.
Hmm.
The only thing is he would have heard whatever we are talking in and around the house, what's happening, everything he'll be aware. The only thing is he's not doing eye contact with anybody while talking. Only which he likes, he's picking up. And if we are telling him something about the homework, he is just ignoring about it. That is my biggest worry.
Correct. So please come in because we also have a team of professionals who can help you out under one roof.
Okay.
So
Okay.
I think you'll definitely be guided in the best possible ways. Okay.
Thank you so much.
Yeah.
Thank you. I'll definitely at the earliest I'll fix an appointment and I'll come there.
Sure.
It is in Manasa Gangotri only, right?
Yes.
Yes.
Inside the.
Yes.
All right. I'll personally come and meet you. Thank you.
Thank you so much.
Yeah, thanks. Bye bye.
It appears that we have run out of time. So I would like to, first of all, thank both the resource persons for discussing about the different problems that a child faces with respect to hearing and even the school problems. And also would like to thank Mr. Rajkumar for relentlessly interpreting it into sign languages. And I would like to thank all the people who called to express their difficulties, their problems, and then hopefully found a solution. And any last words, if you can?
Yeah, I think Chandni had talked about bottom up processing and how we can help. But yes, what I'd just like to tell you is there's a major percentage of children with learning disability who can have central auditory processing problems. And like she said, we have bottom up processing and top down processing, and especially top down processing comes into play when we have to improve their language skills, we have to improve their cognitive language skills. Okay, so it could be their thinking ability, it could be their organization ability, it could be their problem solving, reasoning, verbal memory, as we say. That means how do they retain information and how do they recall information and how do they produce that information. Okay, so this is something that we focus a lot, but what is most important, I would say, is you have to look from the foundation skills. Okay, so that's why I second when Dr. Chandni said it starts from auditory discrimination. We move on to, even before we move on to spelling or reading, writing, we work on language skills. We have to improve their vocabulary. We have to work on their sentence
Yeah.
structures, their narrations. Then we move on gradually to their spelling skills, or we would call it as phonological awareness skills. Then we move on to reading skills, and then we move on to written language skills. So this is how we have to look at a child with learning disability who also has an auditory processing problems. So we label them more as language based learning disability. So this is what I would like to say from my perspective, if Dr. Chandni wants to add something.
Okay. No, I
No.
support what Jayashree said, and I would like to thank you. And just it's a request for parents that don't label your child as lazy and saying that he doesn't want to study. Try to identify the problem and get him to a correct profession.